Vaccination conspiracies. Vaccines, once celebrated as the cornerstone of modern medicine. But what if the truth isn't as simple as it seems? The world tells us to trust the science. But how can we when the very institutions we rely on have been caught hiding truths in the past? What if the narratives we've been fed are not just incomplete, but intentionally crafted to deceive us? The questions surrounding vaccines are not just theoretical. They could be a matter of control, manipulation, and power. And so we must dig into the theories that make us question everything we've been told. One of the most chilling theories that lingers is that vaccines are used as a tool for population control. It's easy to dismiss as paranoia, but can we ignore history? Governments have engaged in unethical experiments for decades, on their own citizens. From the Tuskegee syphilis experiment to forced sterilizations, the record is clear. The authorities don't always have our best interests at heart. Is it really so impossible to believe that the same institutions might use health measures as a form of control? There's no solid evidence, of course, but history tells a different story. What if vaccines aren't just about health, but about reducing the population in the name of global stability? The thought is unsettling, but when you look at history, it's not as far-fetched as we might want to believe. Now there's the theory that Big Pharma is more interested in profits than in public health. Vaccines are a multi-billion-dollar industry, and it's hard to ignore the fact that these companies stand to make massive amounts of money on global vaccination campaigns. Pharmaceutical companies aren't just in the business of saving lives, they are in the business of making money. We've seen this before, most notably with the opioid crisis. Pharmaceutical companies downplayed the addictive nature of painkillers for years, knowing full well the consequences. And now these same companies are pushing vaccines on the world, profiting off our fears, all the while claiming to have our best interests at heart. But we've seen the damage they can do. How many lives have been sacrificed for their bottom line? Sure, vaccines save lives, but when you factor in the profits, we must ask ourselves, are we simply another commodity in their vast empire? The link between vaccines and autism is one of the most infamous conspiracy theories, and it refuses to die. While the original study that made this claim was discredited, the stories from parents who claimed their children's health changed after a vaccination are impossible to ignore. The science says there's no link, but the lived experience of countless families tells a different story. Could it be that the original fraudulent study was just the tip of the iceberg? Could there be forces at work silencing those who speak out, afraid that exposing this truth would unravel the whole system? The voices of parents who swear that vaccines played a role in their child's autism can't just be brushed aside. Maybe the medical community has ignored this pain for the sake of keeping the narrative clean. And then there's the issue of vaccine ingredients. Mercury, aluminum, formaldehyde. These are substances that are toxic in large amounts, yet they're used in vaccines. It's not a conspiracy theory to ask why these chemicals are included. If the science is so sound, why does vaccine manufacturing need preservatives and adjuvants that raise so many questions? Sure, the amounts are small, and most experts say they're harmless. But with all the money and power at play, can we really be sure? After all, we've been told things were safe before, only for it to turn out that we were misled. Think about the countless safe products that have turned out to be harmful years later, like asbestos, lead in paint, tobacco. Could there be a similar story here? If the goal is public health, shouldn't transparency about what's in these vaccines be a non-negotiable? But as we've seen time and time again, transparency is a luxury that the public often doesn't get. Then there's the more disturbing theory that vaccines are part of a broader agenda, one of control, surveillance, and manipulation. It's hard to deny that we live in a world where data is king, and privacy is slowly being eroded. Governments and corporations are tracking our every move, analyzing our behavior, and now, pushing vaccines under the guise of public health. Could it be that the vaccine push is part of a larger system of surveillance, monitoring our bodies under the pretext of safety? Imagine a world where every vaccine is linked to our digital identity, an easy way for governments to track and control us. Does that sound like a conspiracy? Or is it simply the next logical step in the digital age, where we've already given up so much of our freedom for convenience? The idea might seem far-fetched, but when you look at the current trajectory of technological advancements and privacy invasion, it doesn't seem that far off. So where does all of this leave us? Vaccines undoubtedly save lives, But let's not pretend that they are untouched by politics, money, or power. The truth is rarely as plain and simple as it's made out to be. When you start to peel back the layers, you realize that nothing is purely altruistic. Governments, corporations, and global organizations all have their own agendas, and those agendas don't always align with what's best for us. Should we accept everything at face value? Or should we question the narratives that are fed to us, even when they come from the highest authorities? It's easy to dismiss conspiracy theories as paranoid, but some of these theories may just be the uncomfortable truth. The reality is darker than we care to admit, and the consequences of ignorance are too great. We have to ask, who stands to gain from this, and who are we really trusting with our lives? Ultimately, while not all conspiracy theories about vaccines are founded in reality, some may expose uncomfortable truths about our world. It's crucial that we continue to ask questions, demand transparency, and scrutinize every aspect of the health system. Because when it comes to our health and our freedom, the truth matters more than ever. And sometimes, the truth isn't what we're told. Sometimes, it's darker. And it's up to us to uncover it.